Good evening, all. We'll wait for 5 more minutes to see to let others join, and then we can start. Hello, all. I guess we can start. Let me just share my screen. Can you all see the presentation in slideshow mode? Can anybody just
Yes.
confirm? Yeah. Okay, thank you. So welcome back to week 7 of PMRF sessions for NPTEL online course Drug Delivery Principles and Engineering. We have been discussing for a few weeks now the old assignments as well as few topics that were covered in the current week. So we'll start with few key points of week 7 lectures. So as you all know, we have been learning a lot about these drug delivery principles and the ways or different vehicles to deliver drugs like metric systems, reservoir systems, hydrogels, and that was one module of the course. And then the next module was tissue engineering, wherein we saw how tissue engineering is done and what is the purpose of tissue engineering, whether you want to replace a complete organ or a part of the organ and how you can do that. There was one technique where we saw that if you have scaffolds, if you have a donor, you have collected the organ from a donor, and to avoid immune reaction you can decellularize that particular organ and feed in the stem cells of the patient, and then replace that organ back into the patient's body to avoid immune rejection. So these were few of the concepts of tissue engineering. And then in the last week we saw an important concept called implant associated infections, where we saw that during surgery and during this tissue engineering, it's possible that some contamination gets introduced into the patient's body, and these bacteria then start colonizing over the implant, and then that leads to further biofilm formation and infection, wherein the last step is the last solution to this problem is to remove that implant. So we saw how that happens, and then there are a few ways of reducing the chances of these implant associated infections, and we saw some of those as well. So in this week, the course has been shifted to something known as route specific delivery, wherein a lot of different routes of delivering drugs has been discussed. So just a minute. Yeah, so what does route specific delivery mean? So all of us must be knowing that the most common route of delivery is oral tablets. We have been taking tablets since we were kids. So apart from that, there are various different routes of delivering drugs, and what specific route to choose for depends on the application, and it also depends on the physicochemical properties of the drug. For example, if you want something to be delivered to the lungs specifically, then instead of taking an oral route, you can also go for a nasal route, wherein you can deliver drugs through the nasal route, and then that has more chances of the drug landing up in your lungs rather than giving something orally, waiting for the drug to be absorbed, and then that drug will then be carried to lungs. So depending upon what application you're looking for, the route of delivery can change, and also depending upon the properties of the drug. For example, let's say you have a drug and it's very acid labile. For example, it gets degraded at low pH. So if you take that drug orally, your stomach pH is very very low, so there are chances that the drug might get damaged at that particular pH, and hence very less will be available for its activity. So depending upon, then you have to avoid the oral route for such drugs. So you have to know what are the properties of your drug, how much dose are you looking for, and what is your application to choose a specific route of delivery. So various different routes were discussed in this week. The first and foremost is oral route, which we are very familiar with, because it comes in different forms. Like you can take tablets, you can take syrups, you can take capsules, and the reason that oral route is preferred is because it's patient compliant. There is no pain involved with it. If you ask a patient to take a tablet versus an injection, most of the patients will prefer a tablet. And it's also non-invasive. There is no pain introduced in this route of delivery. But as I said, all the routes will have their own disadvantages and advantages. So the disadvantages associated with oral route are first pass metabolism. This is something which we have seen in the initial lectures. First pass metabolism is where you take a drug orally, and then most of the drug will be carried to the liver for metabolism, and then that drug is lost basically. So very low amount of drug will be available for its activity. So this happens with all the drugs that are taken through oral route. So first pass metabolism is one disadvantage. So to avoid that, you then have to administer a lot of drug to achieve the therapeutic level. Also, it suffers from degradation in GI tract. So your gastrointestinal tract, as I said, in the stomach there is low pH. There is also a mucus layer lining this GI tract. So a lot of drug will be degraded as and when it passes through this route. So these are some of the disadvantages of oral route. And something known as formulations were also discussed in this week, wherein a bit more details were given about how oral drugs are formulated. So your capsule or tablet is going to have drug, it's going to have various different excipients, and it will have binders also. So you need to keep in mind what excipients and binders to use to make a tablet which will then give you the best possible results for the treatment. So this was about oral route. Then as I said, most of the drugs that are taken orally will be degraded. So to have some control, and they'll be eliminated at a very faster rate. So to have some control over these drugs that are administered orally, we have something known as controlled release dosage forms, and these could be your osmotic tablets. So if you people remember, we have discussed about osmotic tablets also few lectures back. So these are nothing but tablets which are made of a specific semi-permeable membrane, and these tablets are only permeable to water, and there's a very small orifice at the top of this drug, at the top of this tablet, for the drug to ooze out. So as and when you take this tablet, water is going to flow in this particular tablet because it has a semi-permeable membrane, and inside the tablet there'll be a push compartment. Because of osmosis, it is going to rise and it will push your drug outside. So in this way you can have some control over what amount of drug is going to be delivered. Then there are something known as enteric coatings. We'll discuss about this in the subsequent questions as well. So enteric coatings will allow you to release that drug only in a specific part of the GI tract instead of releasing in the stomach. And then there is something known as bioadhesives as well, which will then lengthen the time the tablet remains in your body rather than completely getting eliminated. So these are some of the ways where you can achieve controlled release with considering the oral route as well. Next was discussed subcutaneous route. So there's a layer below our skin. This is known as the subcutaneous layer, and that's where these are all parenteral routes. So you have to inject the drug in these routes. So subcutaneous is where you take an injection and you carefully just penetrate the skin layer and release your drug or whatever you have in your syringe inside the subcutaneous layer. So as I said, this is injected under the skin, and as a result this is a very invasive process. The patient is going to feel some amount of pain since you're now injecting something into the skin, and the disadvantage with it is it can only hold, so there's a very limited space there below your skin above your muscle. So only about you can only inject somewhere around 2 ml in this. So as a result you have, there's a limitation of how much amount of drug you can give. So to give more amount of drug, you have to make concentrated formulations of the drug if you are giving it by subcutaneous. So the advantage with this is it will bypass the first pass metabolism. Now since you're not giving drugs orally, so they won't be carried to the liver to that extent and metabolized. So subcutaneous route is also used to bypass the first pass metabolism. So let me know if I'm going too fast, or if something is not clear, I can repeat it again. So the next route is intramuscular. This is somewhat similar to subcutaneous. So you have a skin layer, then you have a subcutaneous layer, and below that you have your muscle layer. So intramuscular is where you take an injection, you release the drug inside the intramuscular in the intramuscular layer. So similar to subcutaneous route, this also bypasses the first pass metabolism, and since it's an injection, it's going to be invasive. And so subcutaneous as well as intramuscular, both of these injections can be administered by the patients themselves, but you need to give some amount of training to the patients of exactly where the intramuscular layer is, and so that they don't mess with the injection. So as a result, some training is needed. So these are two disadvantages with the intramuscular route. They're invasive and training is needed, but it's advantageous in the sense that you can completely bypass the first pass metabolism. And then another route that was discussed is transdermal route. So this is where you can put a patch on the skin. You must have seen people using insulin patches or something. You just put a patch on the skin. The drug will then flow from that patch into your skin layer, and then it will be absorbed in the bloodstream. So this is the transdermal route. So if you want to have a local effect, let's say I have some disease that is only affecting my skin in this particular area. So rather than letting the drug flow all over my body, I'll just take a patch of the medicine and put it over that particular area so that it has a local effect. Advantages, it's easily administered. You just have to take a patch, put it on your skin. It's not invasive. People don't feel any pain in this, so it's very patient compliant as well. The disadvantage with it is the drugs which can be administered through this transdermal route have to be of low molecular weight. We'll see the reason of why this has to be. And also a very low amount of drug can be delivered through this route, and it can also be prone to immunogenic response. So this immunogenic response can be for other routes as well, but it's more prominent in the transdermal route because your skin is the first layer of defense against a lot of pathogens. So as I said, there's a limitation of what amount of drug as well as what kind of drug you can give through the transdermal route, but this can be enhanced using various chemical and physical methods. So there is something known as microneedles, where if you guys have gone through the lectures, you will be recollecting it. So microneedles are these tiny needles made out of a polymer, which if you then put in the skin, they will penetrate the transdermal layer, so they won't go as deep as where your nerves are, so the patient won't feel any pain, but it will just make a way for the drug to be delivered successfully. So more amount of drug can now be delivered through the transdermal route. So these are some of the routes of delivery and their advantages and disadvantages. So with this in mind, we can then look at few questions. If you guys have anything to ask or anything to discuss before we move on towards the assignment, we can discuss that. Okay, somebody is asking me. We'll take the questions regarding the exam after the session is done. We'll first discuss few assignment questions. Shall I move on with the assignment then, if nobody has a problem here? Okay, I'll take that as a yes. So the first one, I hope all of you can see the question on the screen. Yeah, so the first question is, which of the following is not a parenteral route of drug administration? You have to choose two options. So I think you people must be knowing by now what parenteral means. So let me know if you have the answer. If not, then we'll discuss. Anyone? I'm audible, right? You people can hear me. Okay, no answers? Okay, then I'll discuss it. Yeah, so the answer to this question is oral and rectal. So what exactly parenteral means is it's a drug administration into the body which bypasses the gastrointestinal path. So delivering drugs with the route which will not include the gastrointestinal path, everything is considered parenteral. So it could be your intradermal, it could be subcutaneous, it could be intravenous, it could be intramuscular, nasal, or intraarticular. Oral and rectal, both of these are a part of your gastrointestinal path. So these are not parenteral routes. Is it clear? Please let me know if I'm not audible or if there are any doubts. So I'll move on towards the next question then. Next is, what are the two most important sites for drug elimination? Go through the options and let me know if you know the answer. You people can just speak up or put it in the chat box.
Kidney and liver.
Okay, we have one answer as kidney and liver. I think somebody has put it in the chat box. Yeah, someone else also has the same answer. Anybody else wants to give it a try? Thank you for responding. No? Okay. Yeah, both of you are correct. The two most important sites for drug elimination are kidney and liver. So there are various different routes of drugs getting eliminated as well, but the major ones are your kidney and liver. And there are some minor ones as well. Pretty straightforward question, nothing much to discuss here. So I'll move towards the next question. Next is, which of the following routes of administration has the least bioavailability for an acid labile drug? You have 5 options and you have to choose only one correct option. So let me know if you know the answer. Anyone? Okay, two of you have answered as the first option. Okay, yeah, both of you are correct. The correct answer is oral route. So, as we were discussing right now, bioavailability. So, it's nothing but the amount of drug that is actually available for its action. So, if you have a acid labile drug, which means that it's susceptible to acidic condition, it will get degraded at acidic condition. So, now if you take the drug orally, so since your GI tract as well as your stomach is going to have very less pH, your drug will most likely be degraded there. As a result, very less will be absorbed into the bloodstream, which will then be available for, which will then flow all over your body and then be available for its site of action. So if you have an acid labile drug and you deliver it orally, it's going to have the least bioavailability compared to all the other routes. Is this explanation making sense?
Yes, ma'am.
Yeah, thank you. Thanks for responding. So we'll move on towards the next question. So yeah, these are advantages and disadvantages of oral administration. The next question is, which of the following mechanisms are not commonly used for permeation enhancement in transdermal delivery systems? Yeah, go through the options and let me know if you know the answer.
Third one.
Surgery.
Surgery.
Okay, I think two people answered as surgery. Okay, thank you for responding. Any other guesses? Okay, no more responses. Yeah, both of you are correct. The correct answer is surgery. So as I was saying that the transdermal route, not all the drugs could be administered through the transdermal route because there's a layer of dead skin cells and lipids, which we'll see in the next question as well. So this layer will not let your drugs permeate, but there are methods of increasing this permeation. So these could be chemical enhancers, wherein you put some chemicals over the skin to dissolve this lipid and the dead cell layer, which will then create a pathway for your drug to be introduced inside the beneath the skin layer. So these could be your DMSO or ethanol, and there are certain conditions for how what exactly your chemical enhancers should have. They should be pharmaceutically inert, meaning they themselves shouldn't have any effect just like the drug. They should be non-toxic, non-allergenic and non-irritating. Apart from this, you could also make prodrugs. For example, now that you know that there's a lipid layer which is causing which is a barrier for your drug to enter, you can make the drug more lipophilic, meaning you can make the drug more lipid loving. It can easily be solubilized in lipids, so in that way it could be it could permeate into the skin layer very easily. Or you can have bombardment, wherein you shoot the particles into the skin layer. It could be ionotrophoresis, wherein you apply electric current for a long duration to destabilize. So all of these methods are basically to destabilize the dead skin layer that you have. And it could be electroporation, wherein you give high voltage electrical disruption, short pulses of high voltage. It could be ultrasound, you can use cavitation forces, or it could be photomechanical energy using a laser. So if you now see the question, it is asking us which of the following is not used for permeation enhancement in transdermal delivery systems. So the only thing that doesn't fit here is surgery. Surgery is not a bait, so you don't make a cut and put your drug there. That's not what transdermal route is. So yeah, I hope this explanation is clear. Then we'll move towards the next question. Next is, what kind of drug is not a good candidate for transdermal delivery? We have to pick two correct options.
Low partition coefficient and high molecular weight.
Okay, thank you for answering first and fourth option. Okay, anybody else? Okay, someone else is also answering the same. 1 and 4. Any other answers? Thank you all for responding. No? Okay. Yeah, both of you are correct. The correct answer is low partition coefficient and high molecular weight. So as we were discussing that the transdermal route will have so yeah, this is the slide. So it has this stratum corneum layer wherein you will have your dead cells as well as a lot of lipid molecules just making a barrier for the drugs to be permeated inside. So now if you have a very high molecular weight drug, it is difficult for it to pass through these pores and get inside the body. So if you have high molecular weight drugs, it's not going to work with transdermal route. Also, if you have low partition coefficient drugs, I hope you guys remember what partition coefficient is. It is the ratio of solubility of a drug in the lipid phase to the water phase. So if you have low partition coefficient drugs, it means that it's more water soluble instead of being more lipid soluble. So you already have a lipid layer here. If you then try to pass the low partition coefficient drugs, they will be hindered here because they are more soluble in water. They are very less soluble in lipids, so they won't be able to pass through this particular layer. So to answer this question, what kind of drug is not a good candidate for transdermal delivery? Your low partition coefficient and high molecular weight drugs won't be very well suitable for this route of delivery. Is it clear? I'll move on to the next question then. Next is enteric coatings are likely to release drugs at what 2 pH? So you have to pick two correct options.
Option 6.
1, 2, 3. Okay, last option, pH more than 8. Okay, you have chosen one option. We have to choose two correct options. So if you have
Option
another,
3 and 6.
option 3 and 6. Okay, either pH less than 2 or pH more than 8. Okay, any other response?
Option 5 and 6.
The last two options. Okay, thanks for answering. Others? Somebody saying option 3. I'm assuming it's for this question. Anyone else? No? Okay, we'll discuss the answers then. Yeah, so the correct answer is last two options. Only one of you answered correctly, I guess. So we'll see what exactly enteric coatings are. So as I said, enteric coatings is a thin film which is applied to a drug. So let's say this dark blue thing is your drug, and then so all of this you're doing basically because you don't want the drug to be released into the stomach, because the stomach has very acidic pH and a lot of different harsh conditions which could then damage your drug. You want the drug to be directly released into the intestinal part. So what you can do is you take your drug, you coat it with a particular polymer. This gray layer, assume it's a polymer, and you choose a polymer in such a way that it will have a lot of carboxylic acid groups, the COH groups. Now what will happen once you deliver this drug orally? It will pass through the GI tract, it will go to the stomach wherein the pH is very low. Now what happens at low pH? All your carboxylic acid groups will be protonated. Protonated meaning they will be of COOH form. The H is still attached to the particular group. So because of this, it will have a very low solubility. The polymer layer will be intact. As a result, your drug will not be released in the stomach. Now as the capsule or the drug form then passes from the stomach to the small intestine, the pH changes very drastically. From pH 2 to it's now going to pH 8. So at high pH, what will happen is there a very low H plus concentration around the drug. The COH groups present in the polymer layer will then deprotonate. They'll lose their H plus and now they are COO minus, which has more solubility compared to your COH group. Now because of having high solubility, the polymer layer will then dissolve at pH 8, and then your drug will then be free to be released. So this is what enteric coating is used for. You avoid the drug release in stomach. Instead, you release most of the amount of the drug in the small intestine. So the question is, enteric coatings are likely to release drugs at, so anything above the acidic pH is the likely answer. So the only two options fitting into the answer are if the pH is more than 8 or more than 11, that's where your enteric coatings will release the drugs. Is this clear? If there are doubts here or if it's not clear, then we can come back to this question again after we finish the entire assignment. So yeah, if there are no doubts, then I'll move towards the next question. Next is the first barrier that is encountered with the transdermal delivery system is. I think we have been discussing this for a long while now. So if anybody knows the answer, do let me know.
Option 2.
Option 2, stratum corneum. Okay. Anybody else? Thank you for answering. Okay. Yeah, you're correct. The correct answer is stratum corneum. As I said, this is the layer made of dead cells and lipid molecules, which then creates a barrier for the transdermal route. So this is the first barrier that is encountered for this particular route of delivery. So yeah, there's no explanation here. Pretty straightforward. Next question is, the major problem of transdermal drug delivery route is. Most of these questions are on a specific route of delivery, so I think you people will be able to answer this. So pick two choices. Which is what is the exact major problem for transdermal drug delivery?
Option 2 and 4.
2, small doses administration is only possible. 2 and 4, drugs with higher molecular weight cannot be given. Okay, thank you for answering. Anybody else?
Two and 4.
2 and 4. Okay, thank you. Anybody else has a different answer from option 2 and 4? No? Okay. Yeah, both of you are correct. The major problem with transdermal drug delivery is only small doses could be administered because there's not much space in that particular area, and higher molecular weight drugs cannot be given because we saw the stratum corneum will not allow absorption of higher molecular weight. So these two are the disadvantages of transdermal drug delivery. Okay, then moving towards the next question. Next is, which one statement is false for bioadhesives? And you have 4 options to choose from. Please read the questions properly. Most of these questions are asking us the false statements about a particular concept. So you have to select what is
Third one.
Third one, chemically bonded bioadhesives are most highly recommended. Okay, we have one answer. Anybody else wants to give it a try? Thank you for answering.
Third one.
Okay, thank you. Others? Okay, most of you are typing. I'm sorry if I'm not able to look at it at the proper time. Okay. Yeah, the correct answer is, both of you are correct. Chemically bonded bioadhesives are most highly recommended is the false statement about bioadhesives. So what exactly are bioadhesives? So these are designed to slow the formulation transit time. So when you take a drug orally, as I said, it will quickly pass through the GI tract. So it has very less time. So the body has very less time to absorb this particular drug before it gets eliminated. So to slow down the formulation time, you use something known as bioadhesives. So what you can do is, you have your drug molecule, you can attach various polymer chains to it so that it will, so something like this happens. So now you have your drug and you have your polymer chains attached to it, and as I said, your GI tract is going to have a lot of mucus. So this mucus also has polymers with chains extending like this. So now if you administer these bioadhesive layered drugs, so these the polymer chains from the bioadhesive are now going to interact with the the polymer chains in the mucus. So as a result, they'll kind of hold on to this particular drug before. So the transit time will now be slowed down. Instead of having a drug that has no chains attached to it, compared to that, now this particular formulation will stay in the body for a longer time. It will slowly pass through it. So this is one way of retaining, kind of extending the half life of a particular drug. So the question is asking us which one statement is false about bioadhesives. First is designed to slow formulation transit time is correct. It can form bonds such as hydrogen bonds and van der Waals, which is also correct. Adhesives can also depend on physical entanglement of polymer with mucus. As we saw in this particular example, here it's just physically entangling with the mucus layer. It could also form hydrogen bonds with the polymers in the mucus layer. And the third option is chemically bonded bioadhesives are most highly recommended is actually false. So the reason for this is if you chemically attach something to the drug, it's possible that it can change the structure of the drug, and it could also render the drug inactive. So this is usually not recommended. So the correct answer to this question is chemically bonded bioadhesives are most highly recommended, which is false about bioadhesives. Is this clear? Okay, then I'll move on towards the next question. I believe this is the last question for the assignment. The last question is which one of these is an advantage of oral administration? And you have a lot of options
Ease
here.
of administration.
Sorry, okay. Ease of administration, okay. Anybody else? Thank you for answering. That's all. Okay, let's look at the answer. Yeah, you're perfectly correct. The correct answer is ease of administration is the advantage for oral administration. If you look at all the other options, you'll get to know it rightly. So first is unconscious patients cannot take the dose is actually a disadvantage of oral administration. So you have a patient that is unconscious and you're trying to deliver drugs. There's no chance the patient is going to take anything orally. Next, low solubility drugs cannot be administered is also a disadvantage. Drugs with low permeability cannot be administered, again a disadvantage. There is a lot of degradation by the GI tract enzymes or flora, which we saw in the previous questions as well. There could be food interactions. Let's say you have just had a food and you don't know how your drug is going to interact with some of the materials in the food that you have had. It could lead to further complications, and also drugs administered through oral route they suffer from first pass metabolism. So the only advantage of oral administration listed amongst these options is ease of administration. It's very patient compliant. So that's all the questions I have for you people today. If you want me to repeat any of these questions, then I can go through. People who have joined late can, if you want me to repeat some of the initial questions, I can do that. If not, then we can stop the session here. Or if there are any other doubts apart from this, then we can discuss those. I think somebody was asking about admit card. When will the admit card be released? So I think you'll get a proper mail regarding this. I don't know when your exam is, the final exam, but you'll be getting your admit cards well before the exam. So I don't think that should be a problem. Yeah, any other doubts here, or do you want me to repeat any of the initial questions? People who have joined late, I can quickly go over the assignment again if you want to.
Ma'am, there is no negative marking for this.
You're asking me or what?
Ma'am, I am asking you.
Oh, okay, yeah. So yeah, I think you will have negative markings. The only questions that will not have negative markings are the numericals, wherein so your exam pattern is going to be you'll have all multiple choice questions like we are seeing in the assignment. So and few questions will be numerical questions wherein you have to enter the answer. So if that so only for numerical type questions where you are physically entering an answer, there won't be negative marking, but for the rest of the questions you'll have negative marking. So what exactly is the amount of that negative marking, I am not aware of. So you'll be getting the instructions before the exam, therein it will be listed. But yeah, be prepared for negative marking for questions other than numericals.
Okay, ma'am.
Yeah, thank you. Welcome. Any other doubts? regarding the session or the content? If not, then we can stop the meeting here and I can meet you people next week. I will be uploading this session online as well. So if anybody has missed the questions, you can go through that session. Okay then, thank you. See you people next week.